What makes a birth traumatic? What are the things that happen, maybe even routine things from our perspective, right? As obstetric providers, we look at things that happen in a hospital all the time. We say, well, that's just normal. That's just routine. That's just one of those things that we do. What are the things that contribute to a birth or an event being particularly traumatic in a hospital? Now, I want to look at several different factors that kind of all combine to make things particularly traumatic. And the first one that I want to look at is called disempowering language. When you think a little bit about language and its effect on memory, language can greatly influence the way that we process memories. When we think about a traumatic medical event, like, I don't know, let's take a manual removal of a placenta, right? That hurts. There's no way around it. That is not a comfortable thing to have done. When you're talking about a manual removal of a placenta, does that become a memory of, wow, that was really difficult, but I overcame it and I feel good about powering through that? Or does it become a memory that you have nightmares of, a traumatic event in your birth? I would argue that one of the things that influences that significantly is language. Think about it this way. I'm going to present the idea of removing a placenta manually. For those of you that aren't familiar with what this is, sometimes the placenta doesn't detach all the way by itself, and after a certain amount of time, particularly if there's a lot of bleeding, we worry about excessive bleeding, we worry about the placenta not ever coming out, and so we have to actually go up and get it, and it's just as painful as it sounds. Literally, I've got my hand inside somebody up to my elbow, scraping out from inside the uterus the rest of the placenta to get it to detach so that the uterus can clamp down and the person can stop bleeding. Well, there are two ways to present that, right? Let's look at the way that I've seen it done, and I just wanted to scream when I've seen this done this way. Excuse me. Wow. I don't have corona, I promise. Just took a sip of Diet Pepsi and it went down the wrong pipe. So the first way that you could present that would be something like this. Hold still, this might hurt. And then when the patient screams, you say, well, you have an epidural, it shouldn't be that bad. You have now made that a traumatic memory because number one, you've taken the power away from the patient, and you've mocked them for experiencing pain. Listen to way number two. You're bleeding a lot more than we would like, and I am concerned for your safety if we don't intervene at this point. My recommendation would be that I remove your placenta manually. Now, I'm not going to lie, this is not a comfortable procedure, and this is going to hurt. I would like the nurse to get us some extra pain medicine, and if you have an epidural, now's a great time to hit your bolus button and get a little extra epidural juice in there. There are some things that we could do instead. We could go back to the operating room for D&C. I do not advise that at this point. We could also just wait and see, although you are losing a significant amount of blood. But here's the thing. This is your body, and I want you to make the decision. Now, with your permission, may I start and may I touch to begin? That's some version of the speech that I usually give. Now, that took a couple extra seconds, but all of a sudden, I've given the patient the power, and I've said, these are my recommendations. These are the benefits of this procedure. These are the risks of not doing this procedure. These are alternatives to this procedure. Here's my recommendation. It is your body. May I proceed with my plan? And if the patient says no, then the answer is no, right? But you want the patient to be able to keep the power that she has over her own body. So language affects where memories go. We know this, right? Language affects the hippocampus, which is the part of your brain up in here that's responsible for helping you store memories. So when we look at disempowering language, the language that we use can either help or it can hurt when it comes to memory processing. And disempowering language comes on a spectrum from seemingly innocent to overtly assaultive. And I want to talk kind of about that spectrum a little bit. So when we're looking at medical terminology, let's look at medical terminology that is profoundly unhelpful. Right? I'm talking about things that routinely show up in obstetric charts. Elderly multigravida. Patient is morbidly obese. Habitual aborter, that's an actual diagnosis, an actual ICD-10 code. Ovarian failure. Notice that all of that language, I mean, if you don't know anything about medicine and you see that in your chart, holy cow, you are offended. I've gotten angry phone calls from people before saying, how dare you, refer to my miscarriage as a spontaneous abortion? And I have to carefully explain the difference between the colloquial use of the word abortion and the medical use, but there are better ways that we can describe the same thing. For example, instead of morbid obesity, I like to, if the EHR allows me to do so, I like to remove that and simply put BMI and a number. That's just stating the facts. That's not that's a neutral term. I am not now making a judgment saying you're morbidly obese, right? Moving on, the second graduation, the second tier is phrases that subtly disempower. Things like this. You can't have a VBAC. You need to lose weight if you want to get pregnant. Well, we'll see if we can have a water birth. I'm not sure. Notice that all of those phrases, they sound innocent enough for the most part, but they're disempowering in that I am now in control. When I say you can't have a VBAC, that is very different than I recommend against a VBAC in your case. However, this is your body and I want you to make the decision, right? Instead of, well, we'll see if you can have a water birth. What's wrong with, in your case, medically, a water birth may not be a great idea. These are the reasons why. However, I'll support you in what you want to do to the best that I can. Much better, right? Moving on, number 3. Now we're getting into stuff that anybody looking from the outside should be able to go, maybe that's not such a great thing. The first one is providers making demands instead of requests. Things like this. I need to start your IV now. Or, we're going to check your cervix. Or, I've even heard this one, if you need to push, you need to get in the bed. Now, all of those things we hear all the time, but those are not requests. Whose body is it that we are wanting to do stuff to? It's not mine. It's yours. Which means that I need to ask permission to do things. What's wrong with saying, you know what, because of reasons X, Y, and Z, your physician, your midwife, if it's me, would like you to have an IV. What if the nurse came in and said that? And then said, may I start one? Well, that's very different than I just need to start your IV. Or how about this? Because of what I am seeing on the fetal heart rate monitor and because you're feeling an increase in pressure, I think it would be a good idea to check your cervix. Would you mind if we did that now? And if so, may I touch? Doesn't take any more time. How about this? We just not tell people to get back in the bed to push. I can catch a baby in just about any position. Caught one on the toilet the other day and it was just fine. But if for whatever reason I need someone to get back in bed, what's wrong with saying, for reasons X, Y, and Z, I think we should get back in bed. Would it be okay with you if we did that? Can I help you back to the bed? That's a very different way of presenting the exact same thing. So let's move on to jokes and insults, even racially charged language. I wish that I could say that, demands rather than requests was the worst that could happen. However, I've seen differently. I remember talking to a patient one time who, when she was telling me the story, started crying. She had been trying to get pregnant and had a successful conception, was so excited about the pregnancy, and she went to her first OB visit, and her doctor that she saw talked with her, did an exam, shut the door, left the room. She could hear everything that was going on, though, on the other side of the door, and the doctor said, I am amazed that anyone would even sleep with her as fat as she is. Can you imagine? I mean, she heard every word of that. How do you think she feels now? What about jokes about Hispanic women and big families? Hear those a lot. What about making fun of names that come from different cultures than your own? I'm talking about, Hispanic names. I'm talking about even African American names. A lot of times people, for example, I grew up in Bend, Oregon, maybe the whitest place on earth. And when I joined the military, I was exposed to a lot of people from all over the country and even all over the world. A lot of people had names that weren't the traditional white bread Bend, Oregon names. And oh my gosh, it was amazing. I was like, wow, there's all these other different people out there. But what if we are so ethnocentric that we're making fun of names other people name their children? I've seen it, maybe even done it. And if so, I am as guilty as anyone else. It all kind of leads to a culture of disrespect, right? This idea that I don't have to remember that you, the birthing person, are my boss. I work for you. If I thought there was a chance that my boss was listening, I wouldn't make fun of my boss out loud. In fact, I wouldn't make fun of my boss out loud because I don't want to get fired. So I don't want my clients to fire me either. And part of that involves watching your mouth. Lastly, in terms of language, we're talking about threats. This can be something as common as, if you don't start behaving, I've heard this before, if you don't start behaving, I'm not going to call anesthesia and get your epidural. Or, if you just hold still while I finish this check, I'll be done soon. That is a threat. Because the implied there is, if you don't hold still, I'm not going to finish this check very quickly. I've even heard and actually experienced one point wanting to sign out against medical advice because my wife didn't want to stay in the hospital overnight, and we were threatened with, you can leave, but we're going to call CPS on you if you do. That is a threat. That is not appropriate in a healthcare setting. The next step after threats, we're no longer talking about language, we're talking about assault. These are unwanted procedures, unwanted things happening to your body. And keep in mind, these don't have to be things that hurt. These can even be things that you, if you were given the chance to, would have consented to, but weren't given the chance to consent to them. Right? I tell my patients all the time, in hundreds of babies that I've had the honor of delivering, outside of training, my episiotomy count is 1. Did one time. And that was a life or death, baby could die if we don't get baby out right now situation. And you know what? Even in that emergency situation, there was still time to present that to the mom and say, baby's heart rate is in the 30s. It's dropping. I think we need to get baby out right now or something very bad could happen. I would really like to do an episiotomy. Is it okay if I do one? And the mom, of course, said, hell yes, cut me, get the baby out. And we did, and baby was fine, and mom was fine. But what about episiotomies that you don't want? They just happen. What about C-sections where mom is getting rolled to the back, protesting the whole way, and everyone's ignoring her? What about cervical exams where mom is literally climbing up the head of the bed trying to get away from you, and you're chasing her with your 2 fingers trying to do your exam? All of these things, in the appropriate setting, mom may have consented to, but when you take away someone's power like that and do things to their body that they don't want, that is now assault. All of these things, language-wise, this spectrum that starts with seemingly innocent medical terms and graduates all the way to assault, all of these things contribute to birth trauma. It doesn't have to be egregious. Please remember this. It doesn't have to be egregious to be called out. I want people to recognize when we're on that spectrum of language leading all the way up to assault, because it is all part of a culture of disrespect, and it all needs to be identified and eliminated.